Hi, everybody. My name is Charli Penn. I am the Relationships and Wellness Director here at Essence Magazine. This is your weekly wellness check, and this week we're going to be talking all about our vaginas. Why? Because it's Sexual Health Awareness Month. We need to talk about it, and thanks to Cardi B and Megan Thee Stallion, we've all been talking about our WAPs, right? Love it or hate it, we've been talking about it, and thanks to that viral video from Cardi herself, we are talking about now more than ever how to make sure that our vaginas are healthy and happy. So I brought two friends along today to help us really dig into the topic. Please welcome Dr. Katina, who is a family nurse practitioner, an author, a speaker, and a TV and radio personality. Hi, Dr. Katina, how are you?
Hello, hello.
Hi, welcome.
Yeah.
And
Hey,
and our other special guest, who I cannot wait to bring in, is sexologist, pleasure alchemist, and author, and speaker, and activist, Anita Kopacz. Anita, come on in.
I love it. I love the list.
All the hyphenates. You both are so amazing. Can we just say I love a multi-hyphenate woman? Okay, this and that and this.
Multi-orgasms.
yes.
That one too. So let's just dig right in, right? So, we've all been talking about WAPs. We've been having fun with the song. It's been a hit. And then Cardi made this incredibly funny and true video about women making sure that they're aware of what the signs are of a healthy or an unhealthy vagina. So Dr. Katina, let's jump right in on that one. What are the signs that your vagina is healthy or unhealthy, and what should we be looking out for?
Well, some of the things you have to monitor is your pH, and I know you all have heard this. We supposed to have a normal pH. However, that's altered by many different things. So a couple things is you're supposed to stay away from scented products. So if it smells good, don't use it down below. Yes, that includes your scented tampons, your maxi pads, even your toilet tissues. I have a lot of patients that come into the office and they have recurrent bacterial vaginosis or yeast, and that's because they're constantly using scented products. Also, you guys know by now, don't douche. The douching actually gets rid of the good bacteria as well as the bad, but we want that good bacteria to be inside of our vaginas. Also, if you have frequent sex and your partner ejaculates inside of you, the semen can cause that vaginal pH to change as well. So you want to make sure that you get creative with your partner and don't be scared of the semen. Have them to ejaculate other places. Explore the semen. Have them to ejaculate on your breasts, in your mouth. You guys communicate that whatever you're open to. You don't want him to ejaculate inside of you every time, because a lot of you all who have experienced BV or yeast, you do notice that most of those infections occur after sex. Also, another great tip is if you do have recurrent BV or yeast, you want to do the tongue check with your partner. And this goes for our same-sex partners as well. So when you get a chance, look in the mirror, your cell phone, stick out your tongue, and make sure it's pink and just a little bit of the white coating. Because if you have a thick white coating, that may be a sign of yeast, and you'll need to see your dentist for further evaluation. But if you have yeast on the tongue, that can actually cause the recurrent BV and yeast as well. So, those are a couple of tips and also one more thing, when you're having sex, stop letting your partner spit on you during sex. If you get a little dried out, we know that happens. If
Use lube. Yep. Yeah, we're all like, yep, use lube.
Especially if the session is long, lengthy, you get a little dried out. Use lube, y'all. Stop spitting, because when they spit, they're actually causing bacteria or whatever. Just like what Cardi said, what he ate that day is coming out. If he didn't brush his teeth before, it's coming out in the saliva and it's going inside of the vagina, and that can enter, the bacteria as well. So you just want to minimize. Of course, we're going to have some bacteria exchange during sex, but you don't want to have an overabundance of it. So those are just some, healthy tips that I do encourage. And how you know that the vagina is healthy is, of course, you have to know your body. So you have to know what it smells like. If you begin to get a fishy odor, then that's not normal. That can refer. It may be trichomonas, or It may be just bacterial vaginosis or another infection as well. Also, if the color changes, and as we know, our vaginal secretion, it does change depending on the period of the month that you're in, right? So you guys notice during your ovulation time, our secretions are I hope you guys know this, but if you don't, that's why I'm educating you all.
Yep. Break it on down.
During your ovulation time, the vaginal secretions is nice and mucousy, right? You can play with it a little bit. But right before, it gets a little thicker and pastier. So you can even see this on the penis or on the toys if you are engaging in sex. And that's because of the hormonal changes. So, just make sure you are aware of your body. Make sure your vaginal secretions are the same. Make sure you are, paying attention to the smell, the amount of discharge as well. Our vagina is self-cleansing. Okay? Cleansing. So I know there's a lot of, yoni pearls, vaginal steams. That's your choice, but I'm all for natural. Let the body cleanse itself. Let the
do what it needs to do,
and it will adjust.
Well, now you all know why we had this conversation at 9 p.m. and not noon today. We want to make sure that we could all come together and have a real girl talk. Dr. Katina, thank you for breaking those down. Anita, I have to ask you, because I love when we have these conversations. How do you personally know when your vagina is healthy and happy? And what do you tell your clients about it? Because, we talk a lot about happy vaginas.
Yes. First of all, I just have to say that Dr. Katina, you dropped the mic on that one.
Yes, you did.
So I have a very sensitive vagina, so I am very particular when caring for her or playing with myself. I always have to make sure I wash my hands before and after. And as far as a happy vagina, that is not just, it's such an important aspect in life, because if we connect to our pleasure, we're connecting to so many different other things, spiritually, emotionally, physically. They say that pleasure is right in line with abundance, as far as being able to practice pleasure regularly in your life. You should be able to be doing something at least once a day that brings you pleasure. If it is touching yourself, then so be it. Allow it to be that. But there's so many other things as well that bring pleasure. And so moving from that place of continuing to bring it, because it's so easy, thinking of the so many things that you have to do and what the world is going through. And actually that is the time where you really have to connect to your pleasure. I know that they say with meditation, if you feel so busy, too busy to meditate, that means to meditate twice as much. And it's the same type of thing with pleasure. If it seems like there's so much going on in the world and it's bringing you down, that is really the time where you have to carve out your self-pleasure time.
I love when you talk about masturbation and sex as self-care, right? Because I think as women, right, we can all admit we don't have that conversation enough.
Exactly.
And it's important to talk about it. And I love when you say twice as much. Like most people, like you said, we're too busy, right? We say, I don't have time. I don't have time. I don't have time. So Dr. Katina, can you talk about, and both of you actually, but we'll start with you, Dr. Katina, the power and the benefit of orgasms and a healthy sex life for a woman?
You got it. I'm actually having a orgasm course that's coming up in a couple of weeks, but I made a post on social media, and so many women, and you know this as well, Anita, I'm sure you've heard this. They've only had one type of orgasm or two types, and that's the, clitoral orgasm or the vaginal orgasm. But there are so many different types of orgasms. You have your anal type of orgasms, your G spot, your A spot, your U spot, your blended, your mental type of orgasm. There are so many different types, and I want you all to start exploring yourself, because having an orgasm is important to the body. Just like Anita said, it helps with sleep. For those of you all who are, difficulty sleeping, it helps decrease stress. It also relieves pain. So for those of you all who are comfortable, masturbating during your periods, it actually helps. It relaxes the smooth muscles. So it helps with menstrual cramps as well. And it just improves your overall mood. So if you think about, just think about that coworker that's always coming into work. She's moody, she's, crabby. And then next thing you know, she comes in one day and like, hey, y'all. You're like, she must have got her some. That is true. That's true. It really, having an orgasm or, sex actually improves that mood. So it's really good for the body.
Amen to that. Anita, I know you want to add, because you were always talking about the power of the P and the O and what that can do to empower a woman and her journey.
Absolutely.
Break it on down, sis.
Absolutely. I love that you said that, because I've actually worked with so many women who have never had an orgasm. And so I know that there's like this mental buildup, like, oh my God, I have to do it. If I don't do it, then what's wrong with me? How come I can't get there? And I've gone through a lot of that, because the reason I even went into this work is because I was sexually molested as a child. And so I ran away from pleasure. Anything that had to do with that, I ran away from it. I wasn't having orgasms. I would have sex, but it wasn't the sex that I'm having now. And so I encourage people to just really move at your own pace, but keep moving, right? And sometimes push yourself past your comfort zone. But if you go too fast, then you have that stress. And if there's any stress, it's really not going to happen in the way that you want it to, especially if especially if you want to like squirt and, really, really go there. You have to be completely relaxed and comfortable in order to allow your body to get to that place. And then yes, it has all of those amazing benefits as far as sleep, pain relief. It actually helps with sexual intercourse as well. It allows you to have an even better sex life if you self-pleasure. And woo, I would say, it's so funny. I'm like, what can I say on here? I know this is Essence.
No, we're keeping it real. We're being honest, but I hear, these are conversations we should be having, and that's why we're having it.
Absolutely.
If nothing else, if it's too, I always tell people, if it's too much for you, at least it's something to think about.
Yes.
Very
good. And I do want to bring up the point too. Having an orgasm, masturbating is amazing, but I don't want you all to fall into that excessive masturbation. Excessive masturbation is actually a disorder, and it can interfere with couples when they engage in sexual intercourse. And I've had many patients, especially when it comes to men, they're used to, masturbating, and they're used to the friction of their hand. So they have difficulty getting pregnant with their partner because they're unable to ejaculate from vaginal intercourse. They have to use their hand in order to ejaculate. And then same thing with the female. Sometimes the nerves become, very, very insensitive. And, it'll be difficult for you to, have an orgasm with your partner unless he's doing something that, you particularly always do to the clitoris and so forth. So just engage in it, but just make sure it's not excessive. Like you're not doing it 10 times a day. You're not leaving work.
I was going to say, define excessive, because I'm sure there's
you're not like
women out there going, wait.
You're not at work saying, oh, excuse me, I have to take a break.
Got it.
Bathroom.
I'm glad you brought that up, because I don't really think, I think I can speak for a lot of women when I say this. I don't think we think about that as being excessive, or dangerous to the sexual relationship we can have with our partners. So I'm glad that you even brought that up, because I don't think that's a topic that we hear discussed a lot.
You got it.
And the partners, well, especially the partners understand, because they'll see, I know for me, like my man, when anytime I have like a new toy coming, he's like,
The shade. Yes. The shade is real.
That's supposed to be for me.
Exactly.
And
But it can be
so,
part of pleasure play. So talk about that, Anita, for
yeah,
sure.
yeah, absolutely. And I know, like with, I know that Dr. Katina was saying that being natural is the number one. I always say we were born with the best toy, right? These two
Yeah.
fingers.
Yeah.
And so, but as far as just having my toys, like I absolutely will bring Sheldon in. Sorry, it's so funny because he's so like reserved and like, it's hilarious. But yes, I do share everything. So, you know, he joins in the play, and you know, we'll tell each other our fantasies, and sometimes we role play, and there's just so many different amazing things that you can do together as a couple. And I know for a lot of people right now, they're in quarantine and may not be quarantined with a person. So I do like to be aware of that when I'm talking about things, but because there's so much that you can do on your own, or phone sex, and that's actually a beautiful way to kind of like help yourself be aroused, you know, like the phone sex and different things bring you into that space of being open, right? And allowing yourself to release, and there's, you know, foreplay starts in the beginning of the day. I always say that because and it looks different for everyone. It might look like doing the dishes, right? Like that is an amazing foreplay for me. And yeah, it's just it's important to figure out what it is that turns you on, you know. And because like for me, that's interesting. Who would have thought doing the
The
dishes
dishes. Yep.
turn me on?
Well, no, I think what you're touching on, Anita, and I'm looking forward to this part of the conversation, are really what some of the secrets are to having a healthy, happy sex life. Because it's also something we should be talking about as much as possible, sharing with our girlfriends, talking to our partner about, more importantly. So can you each talk about what it means to have a healthy sex life and how people can encourage and use this extra time that they have together to encourage that?
Yeah, so you know, I'm big on communication. No one should ever have a bad sexual encounter. That's how I see it. We are too, you know, we're mature. We're mature. We're adults. If you don't like a certain thing, let your partner know.
Yeah.
You shouldn't, you know, suffer while you're having sex if you don't like something. Talk to them sexy.
Speak up. Yeah.
Yes, speak up. You got it. You know, just say, baby, you know, like if they're biting you, just say softer, baby, softer. You know, just, you know, you don't have to, you know, detour the mood or anything, but you just have to communicate. And hopefully your partner, and you can be open with your partner as well, and just be open to their ideas and what they like as well, so that you all can have an amazing experience. Because what one partner like, the next one might not like. One partner, your old partner, might like when you know, slopped on his penis, but the next partner may not like that, you know. So, you know, or, you know, you just have to communicate. You should never have a bad sexual encounter, right, Anita? You agree?
I agree.
Be
I
specific,
agree.
be open. Anita, what would you add?
I would say that just to remember that every day you're a different person, and like be open to new things, because I know that sometimes people like go in and they're doing the same thing over and over and over, and we are beings that are evolving every day, and our sexual life is evolving as well. So pay attention to that. Be open to what comes into your space, you know, because what you didn't like before, you might like now. And that's, you know, it's really interesting how things change. We totally move and change as long as we allow ourselves to. And then as we change, we can evolve. And it's so interesting because I am 44 now, and I have a feeling I might be going into, well, this could be all in my head, but it feels like I might be going into either premenopause or something like that, because I would say like 2 weeks ago, I was hot and ready to go, right? And I wasn't getting wet. And I was like, what? And I'm WAP all the way. All the way.
You're like, this is not normal. Something's wrong.
I was like, what is up? And then I remembered that I had received, because I've never had to use lubrication, and I had received the CBD lubrication from this event that I went to, and I was like, go get that, babe. Go get that. Let's try it out. Oh my gosh, it was amazing. It was amazing. I was like, I want to create my own CBD, like my own lubrication, because this is so great. It's like a whole, even like, like I didn't shame myself, I guess it is, for not getting wet, which I could have easily. I could have been like, oh, like, and not been open to a solution. And no, I didn't.
I'm so happy that you said that, right? Because this conversation is something that we're having because we want to bring these topics to the forefront. We want them to be things that you're talking to with your girlfriends all the time, but we also don't want any of this to be something that you shame yourself over. So if it's not something that you've experienced, if it's not something that you've yet tried, or something that maybe doesn't make sense to you yet, that's okay, right? Yeah. We don't judge ourselves. And in that vein, let's talk a little bit about our different products and methods. Like if somebody's saying, okay, well, maybe I am a little dry, or maybe I'm not masturbating enough, or like maybe I'm not taking the best care. Where would you guys recommend that a woman start, in addition to the medical warnings that you brought up in the beginning, Dr. Katina, but just in terms of like luxuriating and pampering our vaginas? What do we do there?
Yeah, so, dealing with menopause is something, and perimenopause is something I deal with, daily in the gynecology setting. And, it's part of life. And like Anita says, make light of it. Don't, make it an issue. It is something that you have to go through. However, there is help out there. I love 100% coconut oil. Unrefined, 100% coconut oil. It works amazingly. And that's not compatible with condoms. So this is protected sex. The use of coconut oil is amazing. They also have Reverie, which is some natural inserts that you can insert inside of the vagina that helps just rejuvenate the vaginal cells. That decreases with decrease in estrogen. So Reverie is a good product. Relizin helps with the hot flashes that may occur. Restella is something natural that helps improve the sex drive. And then also you have your primrose oil and your flaxseed oil that helps as well. So for you all, who are really going through perimenopausal or menopause, there is help out there. Last resort, if you have to go to hormones, I would recommend vaginal hormones, like your estrogen creams, your Premarin creams via the vagina, versus oral hormones. But there are hormones out there that can help as well. But I like to really push more natural for my patients. And then also, I like when Anita said mental has a lot to do with, the vaginal lubrication. If you're stressed out, if you're worried about something, if you have a lot going on, you won't get lubricated. You won't be in the mood. So that foreplay of, he's washing the dishes today, or she's washing the dishes today, that turns me on. I like that. He's ready for some. I'm going to give him some when I come in today, so that is a part of the foreplay. And that was amazing to say. But those are just some things that I recommend to help with vaginal lubrication, increase libido during times of perimenopausal and menopause.
No, that's great. And Anita, what about you? What's in your cabinet? What's in your bag of tricks, sis?
Well, I thank you so much for saying all of those things. I feel like you covered it all. But for me, I drink a lot of water. I eat a lot of fruits, and greens for me, as far as intaking as natural as possible, really helps everything, all the parts of my body. And I don't have like this, like literally and I wish I had the name of it. I don't have the name of it. I'll send it to you as far as the name of the CBD oil that I used, or lubricant that I used. It was amazing. And that was the first time I've ever used a lubricant. And so that's actually kind of new in my system here.
And you're glowing about it, I see. So everybody, Anita will come back and drop the link in the comments. Share it with everybody, because look at this glow. Yeah, that's an endorsement, but continue. I'm sorry.
Well, it's wonderful because it not only, and I guess because it's CBD, I don't know. I actually not really taken any CBD products, so I don't know exactly how it works. I have rubbed like CBD oil on my arm, and it totally took the pain away. So I know it works. But my vagina was feeling so good for so long after. It was just like I don't even know what it did. It was like it's extra. Like I had the orgasms and I had the CBD in there, and fully put me into this place of receiving all of that pleasure. So, and I'm going to make my own. So I'll definitely share that with you when I
Coming soon, everyone. And really quickly, Dr. Katina, are there any warnings, anything we should know about CBD? I've seen a lot, to Anita's point, a lot more CBD products for our vaginas. Any warnings, anything to know, anything to consider medically speaking?
So far with the CBD oil, using it as a vaginal lubricant, it's fairly new, but it's getting, a lot of attention now. And so far, so good. So, there aren't any warnings. You just have to make sure that, you don't have any allergies to anything that's in it. And you would you see if you're allergic to it by putting it on your skin first, just to make sure you're not allergic to it.
Absolutely. Well, it's on my list of things to shop for as we continue on our self-care journeys, right? In the time of the pandemic and the quarantine and all this time we have together. And speaking of that, we have also been talking a lot about what we say to each other, but I don't want us to end without talking about what we should say to our daughters, right? Because these are conversations that we should not just be having with each other, but with our daughters when when it's age appropriate, especially as they enter college or begin having sex. And we really want to promote positive sexual health with our daughters and have them know the facts as early as possible and be clear on them. So what advice, start with you, Dr. Katina, and then Anita, you please as well. What advice do you all have with communicating with our daughters about sexual health? And Dr. Katina, I know you wrote a book about this.
Yes, actually, I have a book, Let's Talk Sex and STDs, the student edition. So for those parents who are not comfortable, or in addition to that talk that you have with your child, my book is an added addition to that conversation. But, first things first, knowing the anatomy. So many of us, even, and I say us because, women in their 30s and up, they don't know their anatomy. They don't know, what the urethra is. They don't know what the vagina is. They don't know, what's going on with their vagina. So knowing the anatomy is important. So you start with that. Knowing what to expect during puberty as well. You want to educate your child for that. And also encourage them when they are getting ready, you're thinking about sex, encourage them to talk to a healthcare provider, or if not their parent, some adult, responsible adult who, would be able to give that correct information. Or again, you can have my book and give that to them as well. You also just want to educate them on the importance of just, staying safe. When you engage in adult activities, there are consequences to the action. So just knowing that there are finger condoms out there that they could use, there are dental dams that they can use during oral sex. And then they can also use, condoms, female and male condoms. So those are some important things, and to know and to educate them on the importance of knowing their self-worth as well. They don't have to have sex with, many different people. Just knowing that they can connect with one partner. You must get tested before you have sex with that person and after, because a lot of times STDs, infections are passed on because people aren't getting tested prior to sexual intercourse. And these are silent infections that can be passed on from partner to partner. So, all of those things I just mentioned is definitely important to talk to, not only your daughter, but your child, your son as well.
Absolutely. And Anita, anything to add as a final wrap here?
Absolutely. Yes. I feel like as early as possible, talking about the anatomy, talking about, how babies are made, because if we do not tell them, someone else is going to be telling them. And I've actually worked with a lot of parents whose children they're watching porn already, so young. And so they're getting an education out there anyway. So as early as possible is really important for me. And for the daughters, what's important for me to share is that that pleasure is their own, right? I think a lot of us go in feeling like we need to pleasure someone else, or they're the only ones that can pleasure us. And so I make sure my daughters, right now they roll their eyes at me, but I still say it over and over again so that they know when the time comes that they can come to me. I just actually bought some condoms for my niece who's going off to college, and my little son saw it. He's like, "Oh my gosh, Mom." And I was like, "Listen, some people are embarrassed to buy condoms, and I'm not." So I'm making sure she has it just in case.
Yeah.
So just little things like that, really allowing it to be an open space, because children are going to relate to it in the same way that you relate to it.
Absolutely. Ladies, you have shared so much knowledge, so much perspective. This was an amazing conversation, a necessary conversation. I thank you both for joining me. Please quickly tell everyone where they can find you on social media or get more information.
All right. You can follow me, Dr. Katina, on IG at DRKATINA _DRK, Dr. Katina _ K, for health and fitness tips. Also my YouTube. So at my YouTube page it has so many years of valuable information, health and fitness tips. So Dr. Katina on YouTube as well.
And Anita, where are you?
Awesome. I'm mostly on Instagram under Anita Kopacz, ANITA, and the last name is KOPA, C as in cat, Z as in zebra.
Ladies, thank you so much. I appreciate you guys so much. And everybody, take care of her.